Hi guys, today's topic is about systemic changes in pregnancy. So we are gonna deal about different systems, how they're gonna get affected during pregnancy, and how a female complains about her symptomatology. So usually tooth decay and gingivitis are more common when we speak about oral cavity. Okay, it's because of increased salivation which is causing hypertrophy, and gastrointestinal tract. A common complaint is constipation, right? Why is this happening? Because of the gravid uterus, it pushing on the intestines, the particularly large intestine, so it aids the food particles or all the solid to move slowly, so that what is the main target of the large intestine is water reabsorption. So as it's going so slow, there will be more absorption of water, because of which we they get complain of the hard stools and constipation. And the other one is discomfort and heartburn. Why is it happening? Because of the hormones estrogen, progesterone, and progesterone importantly because it's a muscle relaxant, because of which the smooth muscles in the stomach and all they get relaxed. So if a female eats a full meal, full stomach, it will tend to relax and push the food outward, upper. So that's the reason they complain about the heartburn and discomfort. So we have to suggest them to sit in reclining position or normal position, or walk for some time, or eat half stomach, eat less meal and frequent meals and all. So coming to the liver. So what happens here? Because of alkaline phosphatase, there are high chances of stasis of bile in the gallbladder itself. So when the bile is not coming out, what happens? Stasis now will get gallstones. So because of which again bile is increased more, and it's coming out and it's causing pruritus. So this is also more common. And then urinary system. What happens in urinary system? We're going to talk about the kidney. Okay, so what happens in kidney? Usually in pregnancy there is a increase in 1 centimeter, and renal pelvis get pressed, and compared to the left one, the right ureter is pressed little more. So what happens? Because of this one, there is more cysts of urine because of the dilatation of the ureter, and there is high chances of UTI. So patient will complain about having frequency urination, burning micturition, fever or something, or sometime it may be a asymptomatic bacteriuria. So here again one more thing we need to talk about is creat level and the urea level and urate level. So creatinine will be reduced, and urate and urea also will be reduced. Nearly 40% of reduction we can see here. And then coming to acid base balance. So what happened here? Because of the hyperventilation, usually what pregnant women do is hyperventilate, because the gravid uterus, it will press the diaphragm, which will be hard for a patient to properly inhale and exhale like normal person how we do. So they'll tend to hyperventilate. Because of this, they'll have respiratory alkalosis. So to compensate, what they do, they'll try to excrete H plus ions more. This will be in the form of urine. So in the respiratory alkalosis, there is a compensatory H plus ion sending out, which is happening through the urine. Okay, so other thing is a bladder. We spoke about kidney, balance, and now bladder. Here we'll have increased vasculature in the trigone place of the bladder. We all know a part where it's triangular space, it's called as trigone. So their vasculature will be increased. And reduced bladder capacity. See, when the bladder capacity is reduced, even half filling or little filling of bladder itself cause urge of urination. So they'll have incontinence, urgency and all. And one more thing we spoke about, the estrogen, progesterone, even in the muscle relaxation during GI, even that comes here. Even because of this, there is a hypertrophy of bladder because of estrogen, and muscle relaxation or hypertonia because of the progesterone. So what is physiological glycosuria? Physiological they'll have a glycosuria where they'll have glucose in the urine. It's because increased in GFR, because of which they'll have reduced threshold for glucose. So when there is reduced threshold for glucose, it will try to escape in urine. It can't handle more, so you have to escape from some or the other way. So it will try to escape from the urine. So physiological glycosuria occurs because of this one. And coming to respiratory system. So here what happens? Because of the gravid uterus, it will be pushing the diaphragm upwards, so lungs also get pushed and they'll have breathlessness. And also because of the widening of the rib cage, which usually happens during pregnancy, there is a more cavity, so more prone for respiratory infections. Okay, and then coming to CVS, cardiovascular system. So what happens here? The heart size increases and also the apical impulse is shifted to the fourth intercostal space, and we also hear the soft systolic murmur, the S1 split, and S3 will be heard louder. So this is called as hemic murmur. And then what else? Blood volume. So what happens to the blood volume? It will be increased, and because of this there is an increased risk of cardiac failure and anemia. It's a physiological anemia. What happens is here no RBC is getting reduced, RBCs remains constant, but because of increased plasma there'll be a hemodilution. So that's how it's happening. RBC remains constant and plasma is increased, so it's being anemic. Coming to cardiac output, it's also getting increased and thus increased heart rate. So BP, because of the trophoblast invasion and decreased peripheral resistance, there is a lowering of BP. Okay, so there is a supine hypotension. When the patient is lying supine, when you measure the BP, it will be less. So it's supine hypotension. It's because the IVC is getting compressed by the uterus. Okay, and coming to sleep. How is Gona pregnancy affect sleep? So here REM sleep, rapid eye movement sleep is reduced. The other systems also contributing to this. So because of which a patient unable to sleep properly. And coming to musculoskeletal system, because of the hormones, so-called estrogen, progesterone, joints and ligaments, they tend to become softened. So they'll have backache, okay, and cutaneous. There'll be hyperpigmentation. If you see the pregnant women's, the abdomen, you'll see linea nigra, stretch marks, everything, hyperpigmented everywhere. Even in the breast, you see the hyperpigmentation. Okay, it's because melanocyte stimulating hormone, it's increased. And also there is increased blood flow to the skin. So we see linea nigra. From the umbilicus till the pubic symphysis, we see a straight line called linea nigra. Okay, it's because of increased pigmentation. Coming to breast, what happens here? There is a high vascularity and also high pigmentation, hypertrophy. It have more blood supply. It is, increasing in size. The color becomes darker, and around the areola you can see dot type things called Montgomery tubercles. Okay, so yeah, this is the end of the session. Thank you so much for your patient listening. Please do like, share and subscribe.